All right, let's review what we call the rotator cuff muscles. These muscles provide support to the weak joint, the glenohumeral joint. We talked about how for increase in mobility, it has a decrease in stability. The passive ligaments and capsular tissues cannot do the job of keeping that glenoid fossa articulating with the humeral head because the humeral head is so much larger than the glenoid fossa. So we have these rotator cuff muscles surrounding the glenoid fossa, and then can provide active stabilization. So again, the rotator cuff muscles are a little bit misnamed. So let's look at them. They are comprised of the supraspinatus, which is in the supraspinous fossa, going to the humerus. You have this is the posterior side on the right side, infraspinatus in the infraspinous fossa going to the humerus, and then teres minor, which is right inferior to the infraspinatus going to the posterior side of the greater tubercle. Then on the anterior side, we have the subscapularis, which comes off the subscapular fossa and goes to the lesser tubercle. And then you can see the supraspinatus going through the acromion space. These comprise the sits muscles. So SITS. So these surround this very unstable glenohumeral joint. So supraspinatus, infraspinatus, teres minor, and subscapularis. What gets confusing is there's also a teres major. Teres major is not part of the rotator cuff muscle, right? So these are the sits muscles. Obviously, teres major could be the T in sits, but remember, teres major always goes with the latissimus dorsi. Teres major is considered the little lat. So think of major, little, kind of an opposition there. So the sits muscles, supraspinatus, infraspinatus, teres minor, and subscapularis. Some details on these muscles: the supraspinatus assists the deltoid muscle in abduction of the GH joint, and the muscle passes under the acromion process, and that's why it's often impinged if that space becomes smaller or the muscle gets irritated and has some inflammation. The infraspinatus is a lateral rotator of the glenohumeral joint. So it comes from the posterior side and goes to the lateral side or the posterior side of the humerus. So it is a lateral rotator, as is the teres minor. So infraspinatus and teres minor work together in lateral or external rotation. Very important muscles in throwing and pitching. Then on the anterior side, off the subscapular fossa, is the subscapularis, and that goes underneath the axilla and attaches anterior on the humerus. So based on the line of pull, it is a medial rotator of the glenohumeral joint. So you have two lateral rotators, one medial rotator, and then an abductor.